Ingrown toenails are typically caused by the genetic shape of the nail. Either the nail is just too wide for the toe itself, or it is too curved and the edges start to eat into the skin. In a younger population, the wider nail we find to be a little bit more common. And then as the foot is growing inside a tight shoe or a very moist shoe, the skin on the side gets pushed into this very wide nail plate and it causes an ingrown toenail. When the nail is too curved, or what we refer to as involuted, the sides pinch and grip into the side walls of the nail known as the sulci, penetrate and cause an ingrown toenail. Both of these nail shapes, which are genetic, can also be influenced by other factors such as one's health, trauma to the nail, or other things that people do like wearing tight shoes or certain types of sport that can encourage ingrown toenails. When you have these two particular nail shapes, even cutting the nail could be problematic, because if you land down cutting slightly towards the edge of the corner when you have an involuted nail, it's easy to leave a little spike there which then grows in to the skin, piercing it and hurting. The infection that one gets with ingrown toenails, it is important to realize, is a secondary feature of ingrown toenails. So if you get the ingrown toenail and you start treating it with antibiotics, it won't work. It will just give you temporary relief because you are treating the secondary infection. What you want to get down to is where the actual nail is penetrating. Now, if your nail is involuted, we can cut down the sides in what is called conservative treatment, meaning that you don't need any injection. It's just very smoothly cut out, snipped out, and it's done. And then we wait to see whether it comes back again or whether you have permanent relief. The other technique is, of course, to permanently change this nail shape. So if it is involuted, change the shape, and that it can be done by certain types of procedures. If it is too wide, also change the shape, and then these normally provide a more permanent solution to ingrown toenails. Whatever the case may be, whether you have it due to a wide nail plate or a very involuted nail plate, we can all agree that ingrown toenails are very uncomfortable. They can often be very gross looking, and they can create a fair amount of discomfort to the person who is suffering with ingrown toenails. So if you have it, don't meddle with it by cutting down the side and trying to snip it out using scissors and different tools at home, because this is what typically leads to the secondary infection. Just pop by your podiatrist, have it cut out professionally, and then to monitor and see whether it is a permanent problem, to see whether you need a temporary solution or a more permanent solution.